watching over there. Myself Prachi Sheikh, student of Marwadi University. Today I will discuss about the indication of joint mobilization. Introduction. Joint mobilization is a skilled passive movement of a joint and associated soft tissues applied at varying speeds and amplitudes for therapeutic purpose. It refers to manual therapy techniques that are used to modulate pain and treat joint impairments that limit range of motion by specifically addressing the altered mechanics of the joint. The varying speeds and amplitudes can range from a small amplitude force applied at fast velocity to a large amplitude force applied at slow velocity. Indications of joint mobilization are pain, muscle guarding, spasm, reversible joint hypomobility, positional falls or subluxations, progressive limitation, functional immobility, capsular tightness and joint stiffness, post-traumatic conditions, and neural pain with joint dysfunction. First, we'll see pain, muscle guarding, and spasm. Painful joints, reflex muscle guarding, and muscle spasm can be treated with gentle joint play techniques to stimulate neurophysiological and mechanical effects. Joint mobilization helps to stimulate mechanoreceptors and reduce pain signals by inhibiting nociceptive stimuli at the spinal cord or brain stem level. The technique helps to maintain nutrient exchange by the motion of synovial fluid and thus prevent the painful and degenerating effects of status when a joint is swollen or painful and cannot move through the range of motion. Reversible joint hypomobility. Reversible joint hypomobility can be treated with progressively vigorous joint play stretching techniques to elongate hypomobile capsules and ligamentous connective tissues. Sustained or oscillatory stretch forces are used to distend the shortened tissue. Mobilization is indicated when restriction is due to tight capsule, adhesions, mild fibrosis or immobilization. Third is positional falls or subluxations. A fault position of one bony partner with respect to its opposing surface may result in limited motion or pain. This can occur with a traumatic injury, after periods of immobility, or with muscle imbalances. Mobilization with movement techniques attempt to realign the bony partners while the person actively moves the joint through its range of motion. Thrust techniques are used to reposition and obvious subluxation, such as a pulled elbow or capitate lunate subluxation. Then progressive limitation. Diseases that progressively limit movement can be treated with joint play techniques to maintain available motion or retard progressive mechanical restrictions. The dosage of restriction or glide is dictated by the patient's response to treatment and the state of the disease. It helps in preventing the further stiffness. Functional immobility. When a patient cannot functionally move a joint for a period of time, the joint can be treated with non-stretch gliding or distraction techniques to maintain available joint play and prevent the degenerating and restricting effects of immobility. Difficulties includes walking, climbing stairs, reaching overhead or squatting. Mobilization improves the range required for these functions. Capsular tightness and joint stiffness. Mobilization stretches the joint capsule and improves accessory movement. Common conditions like frozen shoulder, post-immobilization stiffness, and early osteoarthritis. Post-traumatic conditions. After injury, stiffness develops because of pain or immobilization. Mobilization indicated after sprains, strains, fracture healing period, and ligament injuries. Mobilization should begin only after tissue healing is adequate. Precautions. Mobilization should be used carefully in elderly patients, malignancy, unhealed fractures, excessive pain, hypermobility in associated joints, total joint replacements, and bone diseases detectable on radiographs. Thank you for watching.